Hello, my name's Dr. Simon Howard and I'm a consultant in health protection in Public Health England in the North East. I'm here to talk a little bit about TB because the 24th of March, as it is every year, is World TB Day. TB is a serious infection which can affect many different parts of the body, but the one we think of most often, most classically, is called pulmonary TB. That's TB in the chest that causes the classic cough that we all associate with TB. It is an infection, it's passed from person to person largely through that cough, but it is a treatable infection. If people see their doctor and are diagnosed with TB and take antibiotic treatment, typically for around 6 months, it's entirely curable. In the North East, TB is really rather uncommon. We see fewer cases here than in any other region of the UK, and in fact our numbers have been going down for the last few years. That said, in the North East, about a third of our cases of TB are in fact in people born in the UK, and there are some groups of people who are at higher risk of contracting TB and sadly of dying of TB if they catch it. These include people who have drug or alcohol problems and people who are homeless. And as a result, we tend to see higher rates of TB in our urban centres, although even here our rates are relatively low. The main symptom people should be aware of in terms of TB is a cough. So a cough that lasts for more than 3 weeks and brings up lots of sputum. And if anybody has a cough like that, they should go and see the GP. There may well be many other things that can cause that symptom other than TB, but it's important that people get checked out. Other symptoms of TB include things like unexplained weight loss, night sweats, a high temperature, a loss of appetite, swellings in the neck sometimes. And it's really important that we encourage everybody in the North East, particularly with one of those long, persistent coughs for several weeks, to go and see their GP. And this is reflected in some of the statistics we see. Almost 40% of cases of TB in the North East wait more than 4 months from the start of their symptoms to starting treatment. And really, the earlier we can intervene, the better. So we really need people who have a long-standing cough to make sure they go and see their GP and discuss their symptom. Education is really key to tackling TB in the North East. We need to get patients who have long-standing coughs to come forward more quickly, and we need to make sure that all of our clinicians are thinking about TB when patients are presenting with compatible symptoms. It's hard when it's not something you see very common, and particularly in the North East population where there are so many other respiratory conditions which are far more common with similar presentations. But for doctors in particular, it's important to consider TB as part of your differential diagnosis if somebody is presenting with compatible symptoms and considering investigating to rule it out. Contact tracing is something we've heard a lot about this year in the context of COVID, but it's been going on for decades for diseases like TB. Every case in the North East of TB has a specialist TB nurse looking after them, and that nurse will also work with them to work out who they've been in close contact with to make sure that those people are given appropriate advice or in some cases tested for TB. This goes on all the time, and it's a key control measure in making sure that TB doesn't spread throughout our population.